Welcome to the module Candida auris, a growing concern in healthcare settings, a Frontline Forces presentation by Superior Health Quality Alliance. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients or family members, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about Candida auris, also known as C. auris. What you know and how you use that information improves the quality and safety of the patients you care for. This learning module, Candida auris, a growing concern in healthcare settings, is the first of a three-part series of modules that explores the important role direct caregiver staff have in understanding the growing health concern related to Candida auris. You are viewing the first module of the series, which provides a general overview about Candida auris. It is not necessary to complete the entire series of modules in one setting. You can leave and return to any of the modules at any time. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Upon completion of this module, you should be able to define Candida auris, also known as C. auris, describe the risk factors that lead to the development of Candida auris, describe how Candida auris is spread, and discuss current health concerns related to Candida auris. What is Candida auris? Candida auris is also commonly referred to as C. auris, and it's a fungal or yeast infection that causes serious bloodstream infections and even death. The data that we currently have indicates that more than 1 in 3 patients with Candida auris die from the infection. Some strains of Candida auris are very resistant to the medication used to treat it, which can lead to serious conditions and death. Candida auris is also becoming much more of a concern, and it spreads very easily in healthcare settings like hospitals, nursing homes, and assisted living facilities. It's important to note that generally speaking, healthy individuals do not get Candida auris. What is Candida auris colonization? Colonization with Candida auris means that an individual has the fungus somewhere present on their body but does not have any active infection or symptoms of an infection. That means that people who are colonized with Candida auris may not know they are colonized and can unknowingly pass the fungus to another individual through person-to-person contact. The most common sites of colonization of C. auris are the skin, nose, urinary tract, and respiratory tract. Someone colonized with Candida auris may later get sick from the fungus, and so that's why prevention is very important in preventing the spread of Candida auris. Candida auris was first discovered in 2009, and it's been spreading rapidly in healthcare settings, including nursing homes. Data from the Centers for Disease Control and Prevention, or the CDC, indicates a 60% increase in Candida auris infections between 2019 and 2021. The COVID-19 pandemic likely increased the spread of Candida auris and prevented the detection of many additional cases. After years of decreasing rates, Candida auris increased again in 2020 with a 26% increase in the rate of cases occurring in hospitals. This is also likely related to multiple factors that occurred during the COVID-19 pandemic. Who's at risk for getting Candida auris? Patients at higher risk of becoming infected with Candida auris include those who reside in skilled nursing facility settings and other similar living situations, or individuals who happen to have very prolonged hospital stays. Individuals with open wounds, ventilators, feeding tubes, or Foley catheters are also much more prone to Candida auris. Individuals with weakened immune systems or underlying conditions such as diabetes, cancer, and kidney failure are also more at risk of getting Candida auris. These individuals all have a harder time fighting off infections. Individuals taking antibiotics or antifungal medication for an extended period of time, which also may cause resistance to the medication used to treat Candida auris. How is Candida auris spread? Candida auris can live on surfaces in the environment for several weeks. It is spread when either someone touches an object or surface that has Candida auris on it, or through person-to-person contact. Why is Candida auris a growing concern? Candida auris is a growing concern for several reasons. There are currently only 3 antifungal treatment options to treat Candida auris. Some strains of Candida auris are becoming very resistant to the antifungal medications, making it very difficult to treat. Many laboratories cannot test for Candida auris, so it often goes undiagnosed or untreated for a long time. And left untreated, Candida auris can lead to serious bloodstream infections and death. Congratulations! You've successfully completed this module, and it is now time to test your knowledge by taking the quiz. Click on the link for the Candida auris, a growing concern in healthcare settings quiz on the Frontline Forces webpage or in the YouTube description below. If you would like additional references on Candida auris, please refer to the following for additional information. This material was presented by the Superior Health Quality Alliance under contract with the Centers for Medicare and Medicaid Services, or CMS, an agency of the United States Department of Health and Human Services.